Thank you all for being here today for our webinar, Data Use Agreements for Public Health Surveillance, an Introduction for Public Health Program Managers. My name is Tom Pryor. I'm a lead senior staff attorney here at the Public Health Law Center, and I'll be moderating today's discussion. A little bit more about the Public Health Law Center. We are located at the Mitchell-Hamlin School of Law in St. Paul, Minnesota, and I want to acknowledge that we are on the indigenous homelands of the Dakota people, also known as the Sioux Nation, and that 4 federally recognized Dakota tribal nations remain in this area. And we appreciate their ongoing stewardship, the spiritual connections and life ways that they've developed in these homelands upon which the law school sits. At the Public Health Law Center, we focus on equity, which is about giving people what they need, which includes understanding barriers, circumstances, and conditions. Effective public health policies must provide benefits to everyone. Research also shows that comprehensive public health policies are best, especially policies that consider the social determinants of health, the network of policies and factors from housing to education to the criminal justice system that impacts people's health and happiness. With that out of the way, I want to introduce our panelists today. We are very lucky to be joined by Carrie Waggoner and Manel Kappagoda. Carrie Waggoner has more than a decade of experience in public health law and health data privacy. She's currently a consultant who provides support and capacity to public health organizations seeking to improve data and health outcomes by providing legal technical assistance, trainings, and practical tools. Carrie's prior roles include serving as Regional Director of the Mid-States Region at the Network for Public Health Law and Director of the Public Health Legal Division at the Michigan Department of Health and Human Services. Thanks, Carrie, for being with us today. We're also joined by my colleague, Manel Kappagoda. She's a senior staff attorney here at the Public Health Law Center. She's worked in the field of public health law and policy for over 2 decades. She began her career as a legal services attorney working in an HIV/AIDS law clinic. More recently, she served as a vice president at the Change Lab Solutions, a national nonprofit working at the intersection of public health and health equity, and as a deputy director at the Public Health Institute, focused on the pandemic response. Her experience working on a wide range of projects across many different public health issues has underscored for her how important access to timely, accurate data is for public health agencies and the communities they serve. With that, I want to thank you, Manel, for being here and presenting, and I will kick things over to you.
Great. Thank you very much, Tom. I am delighted to be here. Good morning and good afternoon, everyone. At the outset of this webinar, the Public Health Law Center team wants to highlight the fact that we are partnering with the Council for State and Territorial Epidemiologists on this project. For those who don't know, CSTE is a national organization that works to advance public health policy and epidemiologic capacity. It's an organization of member states and territories representing public health epidemiologists. CSTE works to establish more effective relationships among state and other health agencies. Their members are a key audience for this project and for the work of the Public Health Law Center more broadly. Especially during this incredibly difficult time, I'm extremely appreciative of partners like our colleagues at CSTE. And as we move forward into the content for today's webinar, I'd like you to warm up your chat muscles by typing something into the chat that you appreciate about your colleagues during this tumultuous period for public health. And just as a note, speakers can't see the chat, but I'm sure that there are really positive and encouraging things being typed into the chat right now. During the pandemic, I took a job at the Public Health Institute working on a COVID-19 response project that required the execution of many data sharing agreements with governmental and non-governmental partners to assist with public health surveillance. And as I'm sure many of you can remember, it was pretty chaotic during the pandemic. And so, as many of us did, I learned on the job as best as I could, and I relied on resources from partner organizations like the Network for Public Health Law, where Carrie used to work. But I remember very clearly how complicated I found this area of public health practice. With this webinar, our May webinar, our technical assistants and the short fact sheets that we're developing, some of which are already up on our website, we're hoping to provide resources that address that confusion I felt when I started working in this space. So let's start with a really basic question. Why do health departments share data? Health departments share data so they can detect and monitor diseases and other conditions that affect community health, such as water quality, for example, be response ready for outbreaks, such as the measles outbreaks that we're seeing right now, inform and disseminate through resources such as dashboards and health education efforts. I'm sure many of the folks on this webinar do that type of work, and investigate and respond to threats to public health. All of these activities depend on the ability of public health departments to receive, analyze, and share data. Today, we're going to talk about the agreements that health departments use to lay out the terms of data sharing. But before we dive into the specifics, Carrie's going to provide an overview of the concept of data governance. And some of you raised the issue of data governance when you registered for the webinar. We appreciated that. And she's going to explain where data use agreements fit into a data governance framework. So I will turn it over to Carrie.
Thank you, Manel. And as I transition, I just want to say I'm seeing in the chat all kinds of things about gratitude and kindness and a shared sense of humor. And that's really one of the things, I've seen in my time in public health, as well as it's just really good to see. So as Manel said, I'm going to do a brief overview of elements of data governance and where data use agreements fit within that process. So it's not unusual for agency staff to start the process of assessing a data sharing request by consulting with their legal or privacy officer. However, that's just one step in what likely should be a broader data governance framework. That question of, is it legal, often starts, and in my experience, sometimes ends data sharing discussions. For example, when I was at MDHHS, that may not be as much the case now as with so much data modernization work going on, and with health departments in various stages of implementing data governance. But while the legal aspects are a key and important piece of the data governance puzzle, there's a lot more that goes into effectively managing data and protecting the privacy and security of that data while making it available for appropriate public health purposes. There is not necessarily one definition of what data governance is. So I have two here on the slide that I like. The first definition, though, I think is more corporate oriented, focusing on regulation compliance throughout the data lifecycle. And government agencies have to think beyond just compliance with laws and regulations, because they also have a duty to serve their constituent citizens. And so I really like the second definition on the slide from Actionable Intelligence for Social Policy. They are affiliated with the University of Pennsylvania, do a lot of data governance work in government spaces with health departments and other government agencies. And so really you're looking at the people, the policies, and procedures that support how our data is used and protected. So really there's not a one-size-fits-all approach. And indeed, data governance is an iterative process that guides a project or data through its life cycle. And when I say life cycle, there are some considerations when we're thinking about data. So how is that data collected? How is it used? How is it stored and analyzed, secured? How do you disclose it, maintain it, integrate it with other data sets? And then when you get to sort of the end of its useful life cycle, are you archiving it or destroying it? So in addition to those kind of what might be data set considerations for life cycle, there could also be considerations when you're looking at a project versus just a data set. So what data is needed for this project? What's the life cycle of this project? And those are certain considerations to think about when thinking about data governance. Who's involved in the data governance process varies. Typically, it's multiple parties and or roles. And again, that could be if it's across your health department, you may have individuals representing each program area or the different data sets involved. If it's a cross-sector data sharing project, maybe with different state agencies or non-governmental partners, And you may have representation from each of those entities and different data sets. So it's typically a multidisciplinary team involved not only in development of data governance processes and procedures, but also the implementation and the ongoing work involved in data governance. And so the data owner, we think of that, or I think, as the leadership position. Typically, this person holds decision-making authority over access and use of the data and is accountable for the quality and security of that data. Data stewards, those are subject matter experts and analysts that work with the data and are typically responsible for implementation of the governance policies and procedures around data use and disclosure. Data custodians are typically IT staff responsible for technology that's used to store, transport, and dispose of data. And then there are other roles involved, and depending on whether, say a cross-sector data sharing project, what those roles are might vary, but certainly would include most likely legal and compliance staff. So at this point, I want to pause. We're going to launch a poll. We'd like to know a bit more about you and your role. So let us know if your work falls into one of these categories. And if your role is more in the other category, take a minute and share that role with us in the chat. We're going to be doing a series of webinars, and it's helpful to know kind of what your roles are as we shape the content for future webinars.
And Carrie, while folks are doing that, I just want to highlight what Taylor Pinsent, one of our colleagues at CSTE, put in the chat, which is that CSTE has launched a new work group focusing on developing, focusing on metadata, data about data, and developing a policy metadata framework. And there's a link there if folks want to join that work group.
Great, thank you. Right, I'll go ahead and keep moving. So although legal and compliance are only one component of data governance, your data governance should include the agency's efforts to comply with relevant laws and legal requirements such as HIPAA and other state and federal laws. It's important to emphasize that efforts to comply with HIPAA, and I mentioned HIPAA in particular because HIPAA requires certain policies and procedures to be in place, training on certain topics, and other efforts to protect the confidentiality, integrity, and availability of protected health information from both a privacy and security perspective. And these are not the same as a data governance framework. The two should really work in tandem, but it's important to know that compliance efforts around HIPAA and other laws are not a substitute for the larger data governance framework, because again, that is an iterative and ongoing process. So I want to end this portion just by highlighting CSTE's, or one of CSTE's stories from the field, which is a great resource with all kinds of stories, success stories from the field. And I want to just quickly highlight Colorado's story on their data modernization work that they've engaged in since COVID. And as I think with many, perhaps all health departments across the country, COVID stretched Colorado's surveillance system to their limits. Colorado then embarked on assessing and creating a replacement surveillance system that would consolidate and integrate what was previously 11 distinct surveillance systems. They chose a new system, surveillance system, and also to create a data lakehouse as part of this project that would house, connect, and share their available data. And the story really highlights the importance of data governance and indeed talks about how key it was to Colorado's process so that they could ensure correct data was being accessed by the correct entities. And just to kind of illustrate quickly how complicated that potentially can be, in this example, Colorado is a decentralized state and has 56 local health departments that would need to have access to some of the data in these systems. So data governance, again, really just key to that and beyond just the legal elements. So now I'll stop here and transition it back to Manel, and she will talk a bit more about what we mean when we say data use agreements and what goes into data use agreements.
Great. Thank you, Carrie. And I before I dive into this, I just want to say we know that there are a lot of folks on this webinar who have a great deal of experience and expertise, and strongly encourage you to put resources into the chat, answer questions, share your wisdom with the other folks on this webinar. So I can see that happening, and we want to encourage people to do that. A data use agreement. Now I'm going to talk about data use agreements and get into some of the provisions in data use agreements. But a data use agreement, or DUA, is a legally binding document that outlines the terms and conditions for sharing and using sensitive data. And in the public health context, the data typically includes protected health information, such as the results of a test for a specific disease or information about an injury. Protected health information is subject to privacy and confidentiality protections under federal law, as well as the law of the relevant jurisdiction where the individual is located. There are three types of agreements that come up most often in public health data sharing. Business associate agreements, or BAAs, memoranda of understanding, or MOUs, and data use agreements, DUAs, sometimes known as data sharing agreements, DSAs. So public health loves acronyms, and this area of public health has a lot of them. Let's start by talking about business associate agreements. The term business associate is a term from the Health Insurance Portability and Accountability Act, or HIPAA. And it means someone who, on behalf of a HIPAA-covered entity, performs activities involving the use or disclosure of protected health information, such as data analysis, health insurance claims processing, or healthcare utilization review, something like that. And typically, business associates are consultants or contractors who conduct activities or provide services to an entity that is a covered entity under HIPAA that involves access to protected health information. For example, a billing company that manages claims processing for a healthcare provider is a business associate agreement. I'm sorry, a business associate. And I remember when I started at PHI, people were talking about BAAs, and I didn't know what a BAA was. And it took me a while to figure out that it meant business associate agreement, and that business associates were not people, but they were these entities, consultants, or contractors. And Carrie's going to provide more information about HIPAA a little later in this webinar. If the health department is defined as a covered entity under HIPAA, staff may have to execute business associate agreements, or BAAs, to share data with certain partners. Not all public health departments are covered entities, though, for the purposes of HIPAA. So it's important to clarify this before entering into any type of data sharing agreement. And in addition, some health departments are HIPAA hybrid entities, meaning HIPAA only applies to the programs in the department that meet the definition of a HIPAA-covered entity. The Health and Human Services website provides extensive information about business associate agreements, including templates. The term Memorandum of Understanding, or MOU, is probably familiar to everybody and also comes up frequently in this work. Health departments may use Memoranda of Understanding in cases where parties want to work together but don't want to create legal obligations that result in liability for noncompliance. An MOU is a formal but non-binding agreement between two or more parties that lays out a mutual understanding of the purpose of data sharing, parties' roles and objectives, the processes that parties will follow, and project goals. Typically, MOUs do not require a lengthy contract review process, making it easier and less time-consuming to execute an MOU than a DUA. And the North Carolina Department of Health and Human Services has created an excellent data sharing guidebook, which Carrie is going to talk about also a little later in this webinar. And it includes an example of an MOU for public health data sharing. Data use agreements, sometimes referred to as data sharing agreements, are contracts that lay out the roles and responsibilities of the parties to the agreement and typically include the provisions that address the relationship between parties and the purpose for which the data will be used. And we're going to spend some time reviewing common provisions in data use agreements in a minute. But before we dive into that, we're going to do another poll. So we're interested in having all of you tell us how long it takes to execute a data use agreement in your agency. And assuming that in many cases it takes longer than you would like, what are the pain points in the process that slow things down for you? We'd like you to put that in the chat. That will help us as we're thinking about resources that we can develop to assist the field if there are specific pain points or barriers that you'd like to lift up for us. Great, thank you. And yep, we're not surprised to see that for most agencies, it takes longer than 8 weeks. I don't think that is unusual at all, but helpful to see that. Would love to hear from the folks that are getting things done in less than 2 weeks. They probably have some lessons that we could all learn from. Thank you. Thank you for that, and thanks for putting information in the chat. All right. Now we're going to go over some common issues that are typically addressed in data use agreements. As Carrie noted, we'll be doing another webinar at the end of May that goes into more detail about some of the topics we're talking about today. We're lawyers, so let's start with the law. Typically, a data use agreement will indicate which laws govern the data covered by the agreement. The recipient agrees to use and disclose the data only as permitted by the DUA or as otherwise required by the law. And Carrie's going to talk in a little bit more detail about laws that are usually included in DUAs. Additionally, the DUA lays out permitted uses and disclosures which align with the specific public health surveillance activities covered by the agreement. So being really clear about your use is important. The recipient agrees not to attempt to re-identify individuals or contact them based on the data. And a data use agreement generally limits access. Access to the data within the recipient's organization is typically restricted to the minimum number of individuals on a need-to-know basis. The agreement also will include provisions about data security and storage. The recipient will agree to implement appropriate safeguards to prevent unauthorized access, use, or disclosure of the data. And the recipient typically agrees to maintain the accuracy and the integrity of the data. The recipient also agrees to store the data securely and destroy it when it is no longer needed. And again, the North Carolina Department of Health and Human Services Data Sharing Guidebook has useful definitions and sample language. A data use agreement should also cover reporting and accountability, including language about reporting violations. The recipient agrees to report any misuse or unauthorized disclosure of the data to the data provider immediately. Auditing, the data provider may have the right to audit the recipient's compliance with the DUA. And accountability, the recipient is accountable for ensuring that any agents or subcontractors to whom it provides the data also agree to the same restrictions and conditions. And I chose this picture on this slide of this cat because I felt like it was just looking at me and it was ready to hold me accountable for something. Just looked so serious. And then this is a bit of a catch-all, but other terms that data use agreements should include are data ownership, so clarifying who owns the data and what rights the data provider retains. Term and termination, so the length of the data use agreement and the conditions under which a DUA can be terminated, and intellectual property. So a data use agreement may address intellectual property rights related to the data and any research or publications resulting from its use. All right, so we're going to draw on the wisdom of all of you again and ask you a couple more questions. So this slide lists all of the things that I just touched on, all of the topics in our whirlwind tour of terms that frequently are covered in data use agreements. What have we missed? Are there other provisions that you would typically include in a data use or data sharing agreement that don't fall into one of these categories. If you could put that in the chat, we would love to know that. And then we also want to know, when you look at this list on this slide, are there specific topics that you absolutely want to know more about? And we're asking that because we will try and incorporate that information into our May webinar. I am going to stop sharing and I'm going to turn it over to Carrie. And she is going to talk about when you need a DUA for public health data sharing.
Thank you, Manel. All right. So I am going to speak a little bit about considerations and thinking through when you need a data use agreement for sharing public health data. I want to start with a quick process point. As Manel was discussing, data use agreements are a contract. And when we're talking about them today, we're meaning really DUAs that are used with individuals or entities outside of the health department. And that's because an entity generally cannot contract with itself. So a data use agreement between two programs in the same health department, for example, would not be legally binding. A data use agreement could be used internally to document data sharing agreements. I've seen that over time in my own work. But I would say consider whether there are different methods of documenting the data sharing, including the legal basis for it within the agency. Because again, that's not a legally binding agreement. In many cases, a data use agreement may actually not be legally required. HIPAA, for example, is one example of a law where in limited circumstances it does require a data use agreement. HIPAA requires a DUA, for example, when a covered entity is disclosing a limited data set, which is a certain subset of protected health information that is allowed to be disclosed for certain purposes. And so when a covered entity is disclosing a limited data set, HIPAA requires that certain terms and conditions be in a data use agreement. So having a data use agreement in place is a best practice, even if it's not legally required. Many laws protecting the privacy and confidentiality of public health data do not explicitly require a data sharing agreement. It's more common for laws to specify the purposes of the data sharing that's allowed or certain entities that data can be shared with, but not necessarily to require an agreement or to go so far as to specify specific terms and conditions. And so this is really where your organization's data governance policies and procedures come into play. So one of the first steps in assessing a potential data sharing scenario and then moving into the legal analysis and data use agreement is defining your use case. And a use case outlines the purpose of the data sharing, the type of data to be exchanged, the rules associated with the data sharing. It assesses the business case, the technical and legal frameworks. I tend to think of it as sort of a factual background to a proposed data sharing project. And it's actually a really great tool once you've developed kind of that factual background to then bring in your attorney or your privacy officer and those who need to help you assess from a legal and compliance standpoint the proposed data sharing. And so one way to start to think through a potential use case is to work through the who, what, why, when, and how of the proposed data sharing. So who is receiving the data? What entity is receiving the data? What entity is disclosing it? Are there multiple parties involved? What data is to be shared from one program source, multiple program sources, for example? Is it identifiable data or de-identified? Be clear on the purpose and goals of the data sharing, whether or not it's an ongoing data sharing process or one-time or one-off, and what are the technical and security aspects that you need to think about. At the end of today's webinar, we'll have several slides with links to different resources, I think, as Manel mentioned, and I just want to lift up one from the Network for Public Health Law. They have a checklist of information that's needed to address and assess proposed data sharing projects. And it's really just a good tool to kind of go through this process I'm talking about right now and document it. And again, then take to others on your team, including your lawyer. So the law itself is complex, as is determining which law applies in a particular circumstance. Federal and state, or even local laws may apply depending on the circumstance. So this list here is not a comprehensive list of laws that may apply. It's just some of the most common. And today I'm really going to give just a very high level overview of these laws. It's important to note that determining what laws may apply to a given data sharing scenario is not a job for public health staff alone. These determinations should be made in consultation with your health department's legal counsel or privacy officer. And again, the reason I'm covering what laws may apply generally today is so that you all can have a general understanding to know kind of what questions to ask generally, recognize when you might need to think about a privacy law and how that applies, and recognize when to bring in legal counsel or your privacy officer, of course, following your agency's policies and procedures. So I'm going to pause here for a poll. Our next webinar will be May 21st, actually at 12 Central Time. For some reason, the time is not on that slide. But we'd like to know what laws you'd like to know more about during that webinar, because we will do a slightly deeper dive into some of them. So now I'll just kind of very briefly go through the most common kind of laws that are listed on the slide, starting with HIPAA, or the Health Insurance Portability and Accountability Act. And HIPAA is a federal law that created national standards for electronic healthcare transactions, and also standards to protect the privacy and security of protected health information, or PHI, as you more commonly hear it. So HIPAA applies to covered entities, typically a healthcare provider, a health plan, or healthcare clearinghouses. And health departments are typically covered by HIPAA, as they often provide services that meet the definition of a covered entity as a healthcare provider, most often, or as a health plan. Many health departments are hybrid entities, meaning they've taken steps to carve out areas of the department where HIPAA does not apply. And we'll talk perhaps in more depth about this during the May webinar, but I also want to just kind of call attention to a forthcoming resource that Public Health Law Center will be putting out on HIPAA hybrid entities. And there's also some additional resources that'll be on those slides at the end of the presentation. But for today, it's important to understand that HIPAA's regulations apply to the data you use and disclose, and therefore it may need to be considered in terms of how much data can be disclosed and for what purposes. And you may also need to consider HIPAA's application when determining the types of terms to put into a data use agreement, or whether a business associate agreement is needed. 42 CFR Part 2 is a federal law that protects the confidentiality of substance use disorder records that are held by Part 2 programs. Again, we'll go into a little more detail about this in our next webinar, but for now it's enough to be aware that this law applies to substance use disorder data that's held by Part 2 programs. And that's a really important distinction when you're looking at whether Part 2 applies to SUD data. You both have to have SUD data, but then it has to be held by a Part 2 program that meets a particular definition under the law. Part 2 is often more restrictive than HIPAA is in relation to substance use disorder information. Although a final rule came out last year that is bringing the two laws into better harmony. So if you might be dealing with Part 2 data, again, bring your attorney or your privacy officer into that data use and disclosure discussion. So the federal common rule is actually not a privacy rule. These are federal regulations that apply to human subject research and set out ethical and other principles for human subjects research. However, there's often overlap when you're talking about research in terms of privacy laws and then common law. And so it's not uncommon in the research context to have to comply with both. And the important thing, that's really the important thing to know here, is that you may need to think about the common rule in addition to HIPAA or state privacy laws. An example is, and when I sat on an IRB many years ago, we were often looking at the interplay between the common rule and HIPAA. So common rule has requirements, for example, for informed consent, where HIPAA has requirements for a HIPAA compliant authorization to disclose protected health information. And often both may be needed depending on the circumstances. And you may also need to think about complying with the common rule, but also HIPAA's privacy protections that are applicable specifically to research activities. In addition to federal law, you'll likely need to consider state public health laws that apply to the confidentiality of public health data. So these laws are generally not as detailed as HIPAA, but may require that the identity of an individual not be disclosed or identified when using or disclosing certain information, such as for communicable disease investigations. And this can be tricky at the state level when the law just says, you know, information can be disclosed as long as it doesn't identify an individual. It's like, what exactly does that mean? How far do you have to go? Does the risk have to be zero, which is typically not possible, right? What's a low enough risk? So that those sorts of determinations can be sometimes a little tricky. So in addition, state law may protect certain subsets of information that's held by health departments, such as data about HIV, behavioral health, and so on. And so these laws need to be evaluated in addition to HIPAA or other federal and state laws that may apply to a particular data sharing scenario. Finally, there's been a trend over the last several years of states adopting comprehensive privacy legislation. And when I say comprehensive, I mean the application of the privacy law is broad, as opposed to covering a certain sector, say like the financial sector, or a certain type of data, like health data. As of earlier this month, 19 states have passed comprehensive privacy legislation, and many more are in some phase of the legislative process. And I mention this here because it's good to be aware of these efforts in your state if they're happening, and how they impact public health, whether in terms of data sharing and disclosure like we're discussing today, or in terms of the impact on public health's collection of data from entities that might be covered by comprehensive privacy legislation. Oh, there it is, the time for our webinar. And so last but not least, save the date for our webinar. We'll feature a little more detail on the laws that apply to data sharing and data use agreements. So as I think we've established pretty clearly, the law can be complex, and it's a key feature in determining whether public health data can be disclosed, to whom it may be disclosed, and for what purpose. As I talked about at the beginning of the webinar, there's the is it legal and the do you need a DUA questions are only two pieces of that larger puzzle of data governance. You also need to consider your health department's policies and procedures. What are the resources? Do you have the resources to engage in a particular data sharing request? Does it align with your organization's priorities and goals, and so on? Documenting these considerations, in addition to the legal and compliance considerations, are a great way to achieve consistency and efficiency in data sharing. In addition, and maybe more importantly, it helps ensure that the privacy and security of information across the health department is properly protected. And I want to again take the opportunity to kind of lift up North Carolina Department of Health and Human Services data sharing guidebook. It's really a shining example of a best practice in terms of data governance. And it's a comprehensive guide. There's a link on the slide here where you can access it, or if you just Google North Carolina DHHS Data Sharing Guidebook, you'll be able to get it that way. But it's a comprehensive guide, not only for data owners, but for data requesters, both internal to the department and external. And the intent of their guidebook is to establish clearer processes for data sharing and integration, again, both intra-departmental within their department and with external parties, including other state agencies. The guidebook clearly states that it's the department's policy and intention that any data request be aligned with its goals, and that the data request drive its mission to provide essential services to improve health, safety, and well-being of all North Carolinians. It goes on to list goals applicable to the agency, while also acknowledging specific divisions and offices may have their own goals. So really, it's, again, comprehensive, striving for that consistency. On this slide, I've included some of the whys that North Carolina identified for having the guidebook. And while an effort like North Carolina's is definitely resource intensive, it's an extremely useful tool for operationalizing data governance processes and procedures, and should make data sharing more efficient after you've gone through the process. And then you've got your process and your guidebook there, which can be reviewed and updated as goals or circumstances change. And I want to highlight one last why that's actually, it's reflected in the guidebook. It isn't on the slide here, but the guidebook clearly communicates North Carolina DHHS's values behind what they're doing, and this can help them communicate more effectively in one voice. So I'd like to pause here. We have one more poll, I think, and I'd like to know where your organization is in its data governance journey. Excellent, thank you. So everybody's in some phase of the process, and it looks like maybe with the majority of respondents establishing and defining data governance framework. So I'm going to close out by just reiterating again that it's best practice to document data sharing relationships and data use agreements, especially again with those external parties, are a best practice to document the legal and other requirements, even though data use agreements are not always required or needed under the law. Typically, your attorney should be involved in the policy and legal review to help assess the legality and requirements in tandem with your organization's policies and procedures. And to the extent that you can, think of your attorney as part of the team and bring them in early and often. Even in my experience, working in legal at a health department, the more I understood about the program, about your particular goals, what you were trying to accomplish with your data sharing, the better the legal advice could be, the more I could be part of the team and creative, as opposed to if I was just brought in at the end of the project, hey, review this and just sign off on it. It from my view, at least, worked much more effectively when I could be part of a team. So to the extent you can and have the resources for that, certainly try to bring your attorney in early and often in your data sharing processes. And so with that, I'm going to transition things back to Tom, who will wrap us up and move on to Q&A.
Making sure I've got the right. So thank you so much for all of that information. I think everybody would agree with me, jam-packed with information, very helpful resources and tools. We do have some time for Q&A. And just candidly, we likely will not be able to get to all of the questions that folks have been asking in the chat and in the Q&A portion, but that gives me an opportunity to plug the fact that the Public Health Law Center offers free legal technical assistance to health departments, public health managers, and other organizations around the country. And that can take a lot of different forms. Sometimes it takes the form of us doing some legal research on a discrete issue and question that you're facing. Sometimes it's us helping you develop a policy or thinking about how to best implement it or even defend it from a legal challenge. Sometimes it takes the place of either crafting publications or directing you to existing publications on our website or on partner resources. And sometimes it takes the form of providing trainings either in person or virtually and designing webinars like this one. I want to qualify that we don't offer direct legal representation, nor do we lobby, but there's a lot that we can do to help direct you to information education outside of those restrictions. Some examples of questions that we've already received include things like, can a local health department share TB treatment data with the state health department? What considerations should a tribal epidemiology center raise with the state health department when developing a DUA to access tribal data? And are there any legislative developments around the nation related to genomics surveillance? So if you have questions like those or others, or the sorts of questions that you've been asking in the chat, please do reach out to us and we can try to help you to the best of our abilities. And if we can't, we can try to find somebody who can. With that, I'm going to close out the didactic part of this presentation and we can enter the Q&A portion. And as a caveat, that is unfortunately not my dog, very jealous. That's Manel's dog, who I think really enjoyed this presentation in the background, I'm sure. So I'm going to stop sharing my screen and ask one question that actually we got in advance of the webinar. And so I want to get through some of those before we get to some of the questions folks have been asking throughout it. And I'm going to direct this to you, Carrie, if that's okay. So the question one participant or registrant asked is if you can talk about the perception of risk versus actual risk in the context of data sharing.
Sure. Thank you, Tom. I think that's an excellent question. And, maybe from situation to situation and organization to organization is something to be evaluated. Health departments have both a duty to protect information and a duty to the public, either a constitutional and or legislative mandate to protect the public's health. And as attorneys, we're really trained, like when we go to law school, we're trained to be risk averse, to be conservative, and to protect an organization's interests. So your attorney represents your health department. And our training really tells us, as well as our ethical and professional duties that we have to uphold as members of the bar, to protect the organization from risk. But health departments are not the typical client, right? There are dual duties there, like I just talked about. And so I think you have to kind of balance both of those out and see, what are the organizational risks, and then, what is the greater duty to the public, both in terms of protecting public health and in terms of protecting your, data on your citizens. So it's a little different than just your typical client.
I appreciate that. Thanks so much. My next question, Manel, is for you. And I know we've kind of talked about some of the links and resources that folks can look at for examples, but just to give you another opportunity to plug that is if you could share some examples or templates of data sharing agreements.
Yeah, I'm sure that there are questions in the chat asking for templates, and we have had a lot of questions generally as we've been working on this project asking for templates. The first thing I'll say is if folks in the audience have examples that are publicly available, please put those in the chat because we want, again, to draw on your wisdom. So if you have examples that you like, we'd love to see those and put the links in the chat. I also want to highlight here that our partner CSTE is developing a library of DUA resources, including sample language as part of this project. And that library should be available in the next few months. So just keep an eye out for that. And one way to absolutely stay on top of what CSTE is preparing is to join the Generating Legal Agreements for Data Sharing, or GLADS, work group that CSTE is running. And this work group aims to foster collaboration among epidemiologists, legal counsel, and public health managers that are implementing legal data use agreements. And it started a couple of months ago, always looking for new members, but they have been talking and sharing resources related to data use agreements. We are going to put a link to the GLADS sign up in the chat. We're also going to put links in the chat for the templates that we found that we think are particularly helpful. The North Carolina Department of Health and Human Services guidebook is a fabulous resource, but there are some other templates as well, and we will pop those in the chat before the end of this session.
Great.
Thank you, Tom.
Yeah, thanks, Manel. Next question, ping-ponging it back to you, Carrie. And the question is, can you talk about interagency DUAs and let us know if there are any particularly helpful resources that address interagency DUAs? And I think that was actually a question asked in this webinar as well as one that was asked in advance of it.
Great. So I think I'll start with kind of what is an interagency data use agreement, and in this context it would be between the health department and another state agency or another entity of local government that are sharing data, perhaps one way or both ways, and so it would be an agreement between those two governmental agencies, and it may often be, and in my experience, a lot of times that was a memorandum of understanding, as Manel had talked about earlier. I'm not aware of specific resources that focus only on interagency data use agreements. Again, North Carolina's data guidebook is an excellent resource, and I do think has some resources on how they handle interagency DUAs. And then I would just actually go back to the answer Manel just gave, and some of those resources I think would be handy. But if anyone participating here has a template or anything that you could share, I think that would be useful to us, and I think all of your colleagues as well.
Thanks so much. Appreciate that. I'm appreciating the wealth of information that's coming through in the chat, which is not always our experience in these. So maybe one thing we can do in the future for webinars is just congregating a really great collection of minds like we have here today, and you all can help each other and we'll help facilitate that. So thanks everyone for being active participants. The last prepared question that we had received in advance that I'm going to ask goes back to Manel. And we've been talking a lot about data use agreements, what they are, when do you need them? And just to kind of come full circle here, when do you not need a data use agreement?
Yes, I'll answer this, and Carrie touched on this in her presentation, but we thought it was important to kind of lift this up. Most privacy and confidentiality laws don't require data use agreements. As Carrie mentioned, HIPAA does in a few limited circumstances, such as when disclosing a limited data set, but it's more often a best practice so that you get everybody on the same page. And your organization may not need a DUA if the information is publicly available or would be available through open records requests if the information is de-identified. It may also be the case that routine sharing with local, state, and federal public health counterparts doesn't need a DUA. But as Carrie mentioned, you should always check with your attorney or privacy officer, as the decision not to have a DUA should be made in a manner that's consistent with your agency's policies and procedures. But we want to make sure that folks aren't overcomplicating things if they don't need to be overcomplicated. And Tom, I'm going to grab the mic here, even though you're moderating the Q&A, and ask Carrie a question, because this is something that we've been talking about. But I saw a question in the chat that was going back to HIPAA hybrid entities, and Carrie mentioned that at the beginning of her presentation. And just somebody asked, what are the benefits of becoming a HIPAA hybrid entity? And I know this is something you and I were just talking about like 2 weeks ago.
Yes. So I think, one of the main benefits is if you become a HIPAA hybrid, well, I guess let me back up. When HIPAA applies to one area of your organization, typically then HIPAA applies to the entire organization, unless you go through this process to become a hybrid entity. And an unintended consequence of that, even though, HIPAA didn't intend to get in the way of traditional public health activities, is that sometimes it does impede public health data sharing when you have to comply with HIPAA as opposed to state law. And so one of the real benefits of going through the process of becoming a hybrid entity is you can actually carve out in your health department which areas have to comply with HIPAA. And so you do a whole assessment to figure out which areas of the health department meet that definition of a covered entity or a business associate. And then those are the areas of the organization that have to comply with HIPAA. So it can make data sharing for those non-covered components a bit easier. And it also, another benefit is that it limits HIPAA's footprint in terms of where you have to comply and how much compliance effort you have to go through, which also limits some of your risk. We know Office for Civil Rights over the last decade or so has been pretty active in terms of investigations and compliance actions, and government agencies have not been immune to that. And so becoming a hybrid entity can also help limit that potential liability, because HIPAA would not apply to your entire health department.
Thanks so much. Appreciate that answer. And I think, as we've mentioned, we are in the process of developing additional resources, some of which we touch on these issues and more. So please do keep checking our website as those are published. I think we have time for one more quick question, and I'll just pitch this to either of you, Manel or Carrie. If you could just maybe 30 seconds talk about the difference between FOIA and DUAs, and maybe some of the areas in which they intersect. And I know this is something that we can explore through additional resources in the future, but that was one of the questions that was asked in the Q&A.
I am going to let Carrie answer this, because I think she handled FOIA requests for her health department, if I have that right. So you're the right.
I did. Person. So that was part of my team. We had FOIA within the team I had at one point. And when I think of it, I think the main difference, when by FOIA we're meaning, Freedom of Information Act laws, where, public record access laws. And so, FOIA, if FOIA typically, says all public or all records held by a government agency, and I'm going in broad strokes here, are subject to open records requests. And then there's usually a number of exceptions so that you can carve out confidential information, health information, and those sorts of things. But information that is disclosed in response to a FOIA request is public information. And so in that case, you really wouldn't need a DUA, because that information should just be disclosed kind of to the public at large. And so data use agreements might be where you're working with a partner. So it's a research institution or a university, for example, another health department, the CDC, non-governmental entities, another state agency, where you're not publicly disclosing information, and you may be providing aggregate data or a limited data set that has some identifiable information or fully identifiable information. And those are where you'd want those terms and conditions and that contract in place to help protect and protect the data and to set out, the terms and the expectations between the parties.
Thank you so much. And thank both of you again for this amazing presentation. I really mean it. It covered a lot of ground. I thought it was very clear, comprehensive. And I think it also, based on the engagement here, demonstrates that there's a real need and interest in this area to explore these topics. So want to thank you again and let everybody know that we will be doing more of these webinars and developing more of these resources. I'm going to end by sharing once again a link to various resources. They've been posted at various times in the chat, but they will be here in the slide deck that will be posted to our website. So you can always come back to our website and check out these resources at your leisure. They are resources on data sharing and data governance. And as I mentioned before, many of these resources also deal with tribal data and tribal data sovereignty. I know that was a particular question that we received. And if we haven't answered your question, or if this inspires some other questions or issues that you're tackling, please do contact us. We can provide free legal technical assistance to help get you the information that you need. And we can also help direct you to existing resources or partners who might be able to better assist you. So our contact information is available there. And you can always go to our website and look us up. And with that, I'm going to thank you all again for your attention, for Stephanie for facilitating this, and for Manel and Carrie especially for putting together this really amazing presentation. Thank you.
Thank you. Thanks, Tom. Thanks, everyone.